Hello everyone, here I'll discuss about the extraocular muscles. It includes the attachments of extraocular muscles, its axis of movements, action of muscles and its nerve supply. Here this is the anterior cranial fossa. This is the superior view of this right orbit. This is a frontal bone. This orbital part of the frontal bone that is taken, it's cut. Can see these extraocular muscles with the associated nerves and arteries. So these extraocular muscles are also called the extrinsic muscles because they are arising externally and is attaching to the sclera. This is the sclera of the eyeball. Then there are 10 extraocular muscles are there. In that 7 are voluntary, 3 are involuntary. These are the fastest and most fatigue resistant skeletal muscles. Their function is to move the sensory organ, that is the eyeball, and it is due to the presence of some specific myosin heavy content chain and the multiplicity of the fibers of these muscles. Here this is the first figure, that is the anterior cranial fossa, superior view of this orbit. This is the anterior aspect, posterior. This is the right orbit. This is medial aspect. This one is the lateral. Here you can see the nerves associated with this extraocular muscles are, this is the optic nerve, it enters the orbit to this optic canal. Here this is the trigeminal ganglion. You can see the ophthalmic, maxillary and mandibular divisions. This is the ophthalmic one divides here. This is the frontal nerve. This is the lacrimal nerve. You can see this is the lacrimal gland which lies superolateral of this orbit. Then posterior medially you can see here these are the oculomotor. This is the trochlea. This is an abducent. These are the cranial nerves. Then superiorly in the middle you can see this muscle. This is the levator palpebrae superioris. Deep to that we'll get the superior rectus muscle. Laterally this is the lateral rectus muscle. Then medially you can see this is the superior oblique superficially. Deep to that we'll get the medial rectus muscle. The second figure, this levator palpebrae superioris and superior rectus is cut. You can see this optic nerve, ciliary ganglion, parasympathetic ganglion and the associated ciliary nerves there. Deep to the optic nerve, here lies the inferior rectus muscle. This is the lateral rectus. Superior oblique, this one is cut into medially. You can see this one is the medial rectus. Okay. So these are the voluntary muscles. So this is the right lateral view. This is the orbit. You can see this is the apex of this orbit. You can see this eyeball sclera. Here this is the sclerocorneal junction. See here laterally this is the lateral rectus. This one is the inferior rectus. This is the medial rectus and this is the superior rectus. These attachments is origin, that is from this common tendinous ring. These 4 recti, that is the common origin, that is from the common tendinous ring. Over this we can see this fibrous ring in the apex of this orbit over this optic canal and the medial end of the superior orbital fissure. Then here this muscle here, this is the levator palpebrae superioris. This is the superior oblique muscle. Here this is the inferior oblique muscle. Then here this is the attachment of this common tendinous ring. See, this is the right orbit, anterior view. This is the base. Here this is the apex. This is the medial aspect. This is lateral, superior, inferior. See here in this apex you can see this is the optic canal in the lesser wing of the sphenoid. This is the superior orbital fissure. This is the inferior orbital fissure. So this is the common tendinous ring. Is a fibrous ring attached around this optic canal and the medial end of this superior orbital fissure. Here we'll get the ring. In relates to that ring, there you can see the optic canal and this contents at this medial end of this superior orbital fissure. You can see the contents over this superior orbital fissure. Optic nerve, ophthalmic artery is there. Here we'll get this common tendinous ring. So in relates to the common tendinous ring superiorly, you can see the attachment of the superior rectus muscle. This is medial, this is lateral. So medially we'll get the medial rectus, inferiorly there is the inferior rectus, laterally there is the lateral rectus muscle. Then above this common tendinous ring, medially there is the superior oblique, laterally we'll get the levator palpebrae superioris muscle. Here you can see this the extrinsic muscles attachments. This is the first figure, lateral view. This is superior view. This is the frontal or anterior view. Coming to the superior view, you can see the elevated palpebrae superioris, that is cut, which lies over the superior to the superior rectus muscle. So it is coming from the part of the bone above this common tendinous ring, goes forwards superiorly to the superior rectus. Insertion I will explain later. Then see the superior rectus muscle from the superior aspect of the common tendinous ring goes forwards superiorly, forwards. Then it's attached to this sclera. This is anterosuperior of the sclera, just behind the sclerocorneal junction and in front of the equator. Okay, so this is the axis. This is the anterior pole. Here we'll get the posterior pole of the eyeball. So axis through this anterior and posterior pole. Here we'll get this one, axis through this anterior and posterior pole that forms the optical axis. Okay, through the center here, this is horizontally, that is the equator. Then here this is the attachment of the superior rectus. Then see, this is the right orbit, this is the lateral view, this is the medial lateral aspect, this is the medial aspect. So in the laterally, you can see this is the lateral rectus muscle from this lateral of this common tendinous ring, then goes forwards and laterally. See, it is forwards and laterally and is attaching to this anterolateral of the sclera. Then can see in the medially, there you can see this is the medial rectus. From this medial of this common tendinous ring goes forwards medially and attached to the anteromedial of the sclera. Then see in the first figure, lateral view, there you can see this is the inferior rectus. From the inferior of this common tendinous ring goes forwards inferiorly, then attached to this antero-inferior of the sclera. So this 4 rectae muscles attachment you can see in the frontal view. So this is the pupil, this is the iris, pupil, iris, cornea, this is the sclera, attachments over the sclera, insertions. So the superior rectus, which lies some 8 mm behind the sclerocorneal junction, that is 8 millimeters behind. This is the medial aspect, this is the lateral. And this one is the medial rectus, which lies here, medial rectus, which attachment that lies some 5 millimeter behind the sclerocorneal junction. Then lateral rectus here, the attachment lies 7 millimeters behind the sclerocorneal junction. This inferior rectus, which lies 6 mm behind the sclerocorneal junction, its attachments here. Then comes the superior oblique and the inferior oblique attachments. Here you can see this is the superior oblique. See here, this one is the inferior oblique. So the superior oblique is coming at an origin, that is from the part above this common tendinous ring, goes forwards, then medially above this medial rectus. Then at the level of this anterior aspect of this orbit, then there is a fibrocartilaginous pulley. You can see this is a fibrocartilaginous pulley which is attached to the trochlear fovea of this frontal bone, orbital surface of the frontal bone. Then it enters through that pulley, then goes downwards and laterally, then attached to this posterior-superior quadrant of the sclera behind the equator. Okay. Then see the inferior oblique. The inferior oblique, that is origin, that is from the orbital surface of the maxilla, medial lateral orbital surface of the maxilla. It goes inferior to this, goes laterally inferior to this inferior rectus, then reaches upwards and medially and attachment to the posterior-superior quadrant of the sclera behind the equator. Okay. Here you can see the axis of this rectae muscles. See, this is the cornea, this is sclera. So this is the right eyeball along with this lateral rectus, and this one is the medial rectus. So this lateral rectus and medial rectus lies in a same horizontal plane. So this axis here, this through this poles, that anterior and posterior pole, that is the optical axis. So this is the superior rectus, below inferior will get the inferior rectus. So the superior rectus and inferior rectus, which lies in a same oblique plane which is making an angle of 25 degree with this visual axis or this optical axis. Then here in this figure, this is also, this one is the right eyeball. Here you can see this lateral rectus. This here will get the medial rectus that is cut. You can see this the superior oblique here. The superior oblique is coming from this part above this common tendinous ring. Forwards, medially it is going to this fibrocartilaginous pulley. Then it goes downwards, then laterally and attached to this posterior-superior quadrant of the sclera behind the equator. See, the inferior oblique is also coming, is posterior-superior quadrant of the sclera behind the equator, that attachment. So, the superior oblique and the inferior oblique lies in the same oblique plane, which is making an angle of 51 degree with this optical axis or this visual axis. Okay. Then here comes this axis of moments. Here you can see this axis of moments. So, the moments are here. There is an adduction, abduction, elevation, then depression, then there is the intorsion and this the extorsion. Okay. So, we will use the pupil as the part of reference of these moments. Here you can see this the pupil here. Here you can see this pupil, this is the iris, you can see this cornea, this is sclera. So, we will use this pupil in terms of this moments. So, the pupil moves upwards, that is the elevation, downwards, that is the depression. It goes medially, that is the adduction, goes laterally, that is the abduction. Moreover, here there is the intorsion and extorsion is there. So, this is that we is explaining in terms of this 12 o'clock position of this cornea. So, the 12 o'clock position of the cornea, if it rotates laterally, that is the extorsion, then upwards and medially, that is the intorsion. Okay. So, this adduction and abduction occurs in a vertical axis. Here, the adduction and abduction that is occurring in a vertical axis. Then this depression and elevation that is occurring in a horizontal axis. Then intorsion and extorsion that is taking place in an anteroposterior axis. This anteroposterior taking in an anteroposterior axis. Intorsion and extorsion. Then here these are the movements of this eyeball. Here this is the right eye, this one is the left. Here this is the medial angle, here this is the medial angle, this is the lateral angle. Here you can see this is the lacus lacrimalis, the triangular area of this medial angle. This is the primary position. Here this is the center. Then here the pupil moves medially, this is the adduction. Here laterally, that is the abduction. Here this is the elevation, moves upwards. Here this is the pupil moves downwards, this is the depression. Here intorsion means that it's a 12 o'clock position of the cornea, which rotates this one to this pupil towards medially, that is the intorsion, and it rotates laterally, that one is the extorsion. Okay. Then, so these are the conjugate moments. Okay, so these moments taking place in a same direction. Okay, this is taking place in a same direction. Okay, here elevation. Then, and also this visual axis lies parallel to each other. So, this visual axis lies parallel to each other in this conjugate moments. Here the muscles helping these moments. So, there is here, this is the right eye, this is the medial angle, this is the lateral angle. Here you can see this is the superior rectus. So contraction of the superior rectus which produces this elevation, then there is the adduction and also there is intorsion. Okay. This contraction of the inferior rectus which one produces, there is the depression, then there is the adduction and also there is the extorsion laterally. Then the inferior oblique, here you can see this is the inferior oblique. This inferior oblique produces, here there is the elevation, then there is the extorsion, then there is the abduction. Then comes the superior oblique. This is superior oblique. Superior oblique produces this one, depression, then there is intorsion, then also there is abduction. This is the medial rectus, contraction produce only adduction. Lateral rectus, its contraction produce only this abduction. Okay. So these are the actions of these muscles. Here you can see this the disconjugate movements. Okay. So in disconjugate movements, here the eyeballs moves in opposite directions. Okay. The eyeballs moves in opposite directions. So in convergence, both the eyeballs moves medially, and the divergence, which is the eyeballs moves laterally. Both the eyeballs moves laterally. Okay. Here you can see this first figure, that is the convergence. Both these eyeballs moves medially here, but in opposite directions. In divergence, here this eyeballs moves laterally in opposite directions. Then here the involuntary muscles. So the involuntary muscles includes this one, that is the superior tarsal muscles, inferior tarsal muscles and orbitalis. Here this is the sagittal view. Upper eyelid, this is the lower eyelid. Here you can see this is the anteriorly, here this is the cornea, here this is the sclera. Here this is the superior rectus muscle, this is the levator palpebrae superioris. Here inferiorly you can see, here this is the inferior rectus muscle. See this levator palpebrae superioris, we have seen the origin, that is from the part above this common tendinous ring. Then see the attachment, insertion of this muscle, so the superior here over the superior rectus, the muscle is lies superficially in the middle of this orbit, superior of the orbit. Then see this levator palpebrae superioris, it divides into three lamella. This is the upper, intermediate and lower. This upper lamella here, this is attached to this orbital septum. Orbital septum, that is the orbital fascia. This orbital fascia which lines this bony part of this orbit, inner bony part of the orbit, and it is forming a septum here, that is the orbital septum here. So this upper lamella is attached to this orbital septum. Then this is the middle lamella. Middle lamella forms the superior tarsal muscles, and this one is attached to this superior tarsals. This is the fibrous, dense fibrous tissue of this eyelid, upper eyelid. Okay. Then this is the inferior lamella here. You can see the inferior lamella. Inferior lamella is attached to this conjoint, superior fornix of this conjunctiva. Here this is the conjunctival sac here. This is the superior fornix. So this inferior lamella is attached as a conjoint connective tissue and is attached to the superior fornix of this conjunctiva. Here this is the inferior tarsals. From the lower end of the inferior tarsals will get the inferior tarsal muscles and is attached to the sheath of this inferior rectus. Then orbitalis, which lies horizontally over this orbital fascia inferiorly. Okay, that is not there in this figure. Okay. So the action of this orbitalis, that one is the protrusion of the eyeball. Moreover, the superior tarsal muscle which assists in the elevation of the upper eyelid, inferior tarsal which assists in the depression of this lower eyelid, superior tarsals which assist in the elevation of upper eyelid. Okay. Then nerve supply of these involuntary muscles, three involuntary muscles, those are through the postganglionic sympathetic fibers derived from the superior cervical ganglion. Okay. Then here comes the nerve supply of this 7 voluntary muscles. Here, you can see here, this is the oculomotor nerve. See the oculomotor. This one is the trochlear nerve. See, this is the abducer nerve. Oculomotor is the 3rd cranial nerve. Trochlear is the 4th cranial nerve. Abducer is the 6th cranial nerve. See, this oculomotor divides into here. This is the here there is inferior and superior divisions. So the superior division of the oculomotor, which supplies this superior rectus, and this one is the elevated palpebrae superioris. Okay, this inferior division supplies here to this medial rectus, then here to this inferior rectus and to the inferior oblique. Then this trochlear nerve here, you can see this is the trochlear nerve. It supplies to the superior oblique. Then here this is the abducer nerve. This is the abducer nerve which supplies this lateral rectus. Okay. So that is the nerve supply of this voluntary muscles. Then here this paralysis of this individual muscles due to the involvement of nerves results in strabismus or squint, which may result in diplopia or double vision. That means seeing 2 images of an object. Okay. So that's about this extraocular muscles, its attachments, its nerve supply, everything. So there are 10 extraocular muscles are there. In that 7 are voluntary, which includes the superior rectus, inferior rectus, medial rectus, lateral rectus, superior and inferior oblique, and levator palpebrae superioris. Okay. Then its nerve supply. Then involuntary muscle, these are the smooth muscles, those are the superior tarsals, inferior tarsals, and the orbitalis. Okay. Hope you understood. Here comes the question. Here, describe the extraocular muscles of the eyeball under the following headings: its origin, insertion, action, and nerve supply. Okay.